Helsi, health tech platform connecting with patients, doctors, clinics, and pharmacies. Welcome.
We are all the same guys. We need water, we like traveling, and of course we enjoy our life. But sometimes we feels everybody sick and bad and sick. So if it happened with me 2 years ago, I understand that I need to go to the doctor and stay in line and stay in the queue about 1 hour. I was a student, I cannot pay for a private doctor, and I understand that I need to pay the most valuable resource in my life. It's my time, and I understand that we need to broken the system. So my name is Andriy Slepucha, and we created Helsi. What does mean Helsi? Helsi is a bank of medical data which close all patient needs in one internet web resource, from booking schedule of a doctor till buying a different medicine. And nowadays our web portal using more than 8 million people. So we broken a lot of traditional stereotypes, and nowadays we made a first time in Ukraine, the first company in Ukraine which made a real-time booking. So Helsi isn't a government company, it's a really private business, and we are really great experience, and we are really great example of partnership between government and private sector. And when we analyzed our patients, we understand that in Ukraine 90% of patients using only state medicine, and we decided to go in this market because it is really global. We created a software as a service decision and for state medical centers, and teach every doctor to fill all medical information about patient in this system, and of course connect it with our patient portal Helsi. And nowadays more than 50,000 doctors using our medical system. Who create? Of course we have a team, it's guys with a lot of business experience in e-commerce, and 50 colleges behind us. What we create? We create the biggest medical hub, 316 degrees around the patient. And nowadays, about more than 50% of our Ukraine, about medical institutions using our medical system. In Kyiv, Kharkiv, Lviv, Odessa, Dnipro, and the next 610 medical institutions. For whom we create the product? We create, of course, for everybody who anytime had any problem with their health. And we know that our market is not unlimited by anything, not even borders, and every day we demonstrate strong growth. How do we earn? We have really good news for our partners. We had good news and better. And nowadays we earn money for selling a license, and it's about $60,000 per 1 month. It is only 20% of all doctor markets. Next year we will raise X2, and we will earn about $120,000 per 1 month, and sale of licenses at the level of 60% of our auditory will allow our startup to go to self-sufficiency. And the better news that all of your model of monetization will help us to earn and make a profit. For example, booking to the private clinic and laboratories, receipts, marketing, big data selling, and insurance company. But the best news is that we understand all our market, and we understand if we cannot sell the more license where doctors using working in our Ukraine. But for this monetization model, we understand that in next few times, in next 2-3 years, this market only in start, so we can earn a lot of money, and will triple on most of these monies. So why do we need to win $10,000 on this project? Because we understand that Helsi, it's not only patient portal, it's not only medical information system. We can do something interesting for our patients, and when if we win $10,000, we can save about $10 for everybody who needs to pass the test on COVID in our country. How we will do it? In $10 million, it's a market in 1 month for tests on COVID in our country, and about 20% of it using with private laboratory. We spoke of them and understand that we can give them the patient, and they will give us a commission. So we can get discount for $10 for our patient and $10 for us. And if we will have only 3% of this market, we earn every month about $10,000. So why I'm saying this? Because Helsi is not only patient service. It's like a tool. It's like an implement which takes care of patients and makes great money. And I'm sure, and you are confident, that in the nearest future all of us will Helsi their doctor, not Google them. Thank you for your attention.
Thank you so much for your presentation. Very energetic.
Thanks.
And we have 4 questions from online judges already.
I'm ready.
So question number 1 from Bas Gotska. How many years are you active in the market?
In the market, we're active about 2 years because in 2018 years the medical reform started in our country and we rewrote our business model, we rewrote our team and understand that we need to grow up in this implementation.
The next question is from Marty Kashubovsky. What countries other than Ukraine are good targets for your system and why?
We understand that in the nearest future we will get out from Ukraine. For example, it's Poland because we're the same market in this country, and maybe Canada and Turkey because there is not the same product in this market.
Thank you so much. And the next question is from Andrian Slivotsky. Scaling this business, easy or hard? Why?
It's a really hard business because we are working with doctors first of all, and we teach them to using the automatic system. We create a soft which doctor don't work last year. So we decided and we understand that it's really hard work, and our employment team works hard on this project.
And the last question from online judges, Bas Gotska. Do you own or co-own the user data?
Of course, about user data, we don't sell it. We using only for example, in depersonalization data, and we can give its information for different maybe farm company and the same if they will need it.
But do you own it to give it?
Of course, we have and document when the patient register on our website, he get a signature that he give us all their information.
Thank you.
You're welcome.
What share of your revenue comes from state clinics?
It's about nowadays it's about $50,000 per month, but you know all of our.
What share percentage of your revenue?
It's about nowadays it's about 50% of our revenue, but when still in 2021 year it will be about 30% because all our different monetization model will grow up.
Okay.
How user can know about your solution?
First of all, we are also organic, so we haven't no any advertising in internet. When people came into the medical institution, they say that Helsi, Helsi, Helsi. If you don't need to stay in queue, please log in Helsi and book their doctor. First of all, we are using this marketing strategy.
How many competitors do you have in Ukraine?
It's about 50,000 doctors in our system and about 8 million activity consumers in our website of the patient.
Competitors, other solutions like yours?
It's about 20 medical information system, but the medical hub is we only one.
What is your market share?
I'm sorry, we have to cancel that question. Thank you very much for your presentation.